Hi, Miss Knott. How are you doing today?
I'm fine. How are you?
Doing well, thank you. Thanks for coming in for voice therapy. It's nice to see you again since our evaluation a few weeks ago.
Good to see you too.
Thanks. And if you'll remember, during the evaluation, again a few weeks ago, some of the things that we talked about that we found in your voice. So the main thing that we had spoken about was the breathiness in your voice, the sound of kind of too much air coming out, and it gives it that very breathy, airy quality. And then along with that, we found some roughness in your voice. So kind of that raspy kind of sound, gravelly, if you will.
Yes.
And also we found a fair amount of strain in your voice, which is kind of that tensed up kind of sound, very squeezed and just a tense sort of vocal quality there. So do you still perceive some of these things in your voice?
I do, yes.
Okay. All right. Well, those are all common things that you'll perceive in your voice based on your physician's diagnosis of vocal nodules. So vocal nodules occur when you maybe don't drink enough water, if you drink too much caffeine, if you have to project your voice a lot, which you do teaching.
As a teacher, I do.
Right, exactly. And, and if you have to speak, even if you're not projecting, you have to speak a lot, as you also do as a teacher. So all of those things can lead to irritation of your vocal folds. And after a while, this irritation of overusing your vocal folds or inadvertently misusing them can lead to these small bumps, almost, if you will, calluses on your vocal folds. And I wanted to show you a picture from the examination of your vocal folds. And can you kind of see these little bumps on here?
Oh, yes.
Exactly. So those are the vocal nodules, as you can see. And then also, do you notice some of the redness in the surrounding area? Some of that can also be irritation that might be caused by your acid reflux that your doctor has also diagnosed you with.
Oh.
Right. So the fortunate thing about nodules are that they can go away on their own. It's not something that you have to have surgically removed. Through a few different techniques that we'll try, you should be able to help your voice and help them to heal. So
that's good to know.
Exactly. So bringing this into how your voice works, I just wanted to give you a quick overview in case you aren't familiar of your vocal fold function. And so your vocal folds, in order for you to speak, come together like this, and then you have to have a buildup of air from your lungs underneath to blow them open and start the sound every time you speak. So sometimes when vocal nodules form, you don't get this full closure that you're used to. And I have another picture of your vocal folds here that you can see. This is when you're closing all the way, and you might be able to see that there's a gap in the front and the back. So you aren't getting this full closure, and what we call this is an hourglass closure. And as you might imagine, when you're building up pressure, the air is seeping through those spaces that aren't completely closed.
That's the reason for the breathiness.
Exactly. It is the reason for the breathiness. So the point of our voice therapy is to, again, help reduce these vocal nodules through a few different exercises and, some vocal hygiene you'll hear me mention, which is just taking good care of your vocal folds. So are you ready to get started?
I am. I'm glad to hear that surgery is going to be maybe a secondary, that we'll try this first.
Exactly. So the first technique that we're going to try is called chant talk. And so this is really helpful with vocal fatigue because sometimes your vocal folds can become irritated with vocal nodules by hitting them together really hard when you're starting your voicing. So if you hear me say, I eat eggs every Easter, do you hear how kind of abrupt and hard that sounds? Well, when we use chant talk, it's kind of a smooth, slow, more relaxed onset of voicing, which should help you to not hit your vocal folds together quickly, which again can irritate them and lead to the vocal nodules. So I'm going to give an example, just doing some counting, and then we'll get you to give it a try.
Okay.
So the chant talk will sound something like this. 1, 2, 3, 4, 5. Did you notice how my voice was kind of slow at the same pitch and the words kind of ran together?
I did.
Great.
I noticed that.
Now will you try counting 1 to 5?
1, 2, 3, 4, 5.
That was great. Great chant talk. So with that, Could you please read this highlighted sentence just in your normal voice this time?
You wish to know all about my grandfather. Well, he is nearly 93 years old. He dresses himself in an ancient black frock coat, usually minus several buttons, yet he still thinks as swiftly as ever.
Okay, now would you try this sentence with the chant talk again, just very smooth and kind of blend the words together almost.
You wish to know all about my grandfather. Well, he is nearly 93 years old. He dresses himself in an ancient black frock coat, usually minus several buttons, yet he still thinks as swiftly as ever.
Okay, great. That's a good start, and we'll work on having it just flow really easily into the next word. And that should help to, again, help your nodules, give them a little time to heal if you aren't hitting your vocal folds together quite as much.
Okay.
So the next thing that we're going to try is something called a confidential voice. And so this is something that's kind of in between your normal speaking volume, which may be a little too loud and hurting your vocal folds, and a whisper. So you don't want it to be a whisper, but imagine perhaps that you're walking into the room and your child's sleeping and you're not whispering, but you're talking quietly in order for them to not wake up. So you kind of want to think about it too as needing to lean in to hear the other person talk, but again, not a full whisper. So it might sound something, using the same passage, it might sound something like this. You wish to know all about my grandfather. Well, he is nearly 93 years old. Do you see how that was kind of in between a whisper and my normal projecting volume?
Mm-hmm. Yes.
Okay.
Mm-hmm.
Now, would you like to try that?
Okay. You wish to know all about my grandfather. Well, he is 93 years old. He dresses himself in an ancient black frock coat, usually minus several buttons, yet he still thinks as swiftly as ever.
Great. And does that feel any different than your normal speaking voice?
Oh, definitely. Yeah, I tend to talk loud.
Okay, well, good. Well, this is something, that might not be ideal for you to use all the time at school because I know that you do have to project at points, but something if you can use at home with your child or, if you don't have to project to the whole class at other times during school to really kind of give your vocal folds just more of a rest, a nice, light, soft voice to give them that time to rest, really.
Yeah, that makes sense.
Okay.
It does, yeah.
Well, great. Well, thank you for working on using a confidential voice and working on chant talk. And those are things that, as therapy progresses, since today's just the first session, we just wanted to get a first look at them. And as therapy progresses, I'll have you do those at home, hopefully in increasing amounts as your voice is improving to kind of give it a rest. But for now, I want to give you a little bit of other homework to work on until we see each other again for the next session. So, I think I mentioned earlier the topic of vocal hygiene, which again is just kind of taking good care of your vocal folds just like any other muscle in your body. And so 3 things that I'd like for you to do this week, and I have this log with the day and the different activities, are to 1, start taking the reflux medicine that your doctor prescribed because again, as you saw in the picture, the reflux can kind of irritate your vocal folds and can contribute to that problem. Next, I would like for you to try and take what's called a vocal nap every day. And it sounds nice, right? Exactly. And so the vocal nap is just resting your voice, not using it for a prolonged amount of time. I put here 2 hours, but I know that might not be ideal to be able to find a 2-hour chunk in your busy schedule with school and coaching and your family. But if you can even break this up into hour increments or 30 minutes, however you feel necessary to start, that's really going to give your vocal folds that time to heal. And finally, I'd like for you to increase your water intake to 64 ounces a day. And I wrote down here the name of an application that you can download on your phone to track that. Because again, keeping your water intake at a higher level, it's going to hydrate your vocal folds just like the rest of your body needs hydration. It's really important.
Okay.
Does that all sound good?
That
moving
sounds
forward?
wonderful. Yes, thank you for these good ideas.
Well, sure. And thank you for coming in today.
Well, thank you, Miss
See you
Knott.
next time.